Well, when it comes to medical tests and screenings commonly prescribed by your doctors, are they as effective as they should be? We've been digging into this for you and found out many doctors are now saying sometimes less is more when it comes to certain testing. Tonight, we're taking action for your health with the questions to ask your doctor, the screenings you should get, and the ones to avoid.
My mom started getting repeated sinus infections.
6 to 8 months of antibiotics didn't cure Christine Martini's 72-year-old mom. In fact,
After she received so many antibiotics, she ended up being in a far worse situation.
Christine's mom ended up with a massive fungus in her sinuses. Doctors determined it was C. diff, an often fatal infection.
Unfortunately, antibiotics are not benign things.
Physician Donald Ford, part of the Cleveland Clinic health system, says the antibiotic issue is one of many concerns you need to talk to your doctors about.
I can do a whole bunch of tests. I can order, go down the list and check off every single thing. Is that going to be good for you? Is that going to help me get to the heart of what's going on with you?
With the help of Consumer Reports, we've come up with a list of questions you need to ask your doctor before undergoing tests or screenings. They include, what are you looking for? What is the test likely to show? What if it's positive? What are my options? Can we put this off? The medical director for Consumer Reports, Dr. John Santa, says everything from imaging tests on back pain after a fall.
Even though we know 90% of the time people will be better in 4 to 6 weeks without doing much of anything.
To ovarian cancer tests.
Sad to say that the blood test and ultrasound for ovarian cancer, not a good screening test. Sorry, we all wish that we had a good screening test for ovarian cancer. We don't.
To screenings for heart disease without major symptoms.
The chances of those heart tests showing anything that's significant are very low. In fact, it's less than them having a false positive.
All tests that are ordered, but they shouldn't be.
Unfortunately, some consumers and some physicians believe that any screening test must be good, and it's quite simply not.
But legal experts say caution is needed.
Don't offload the risk onto the patient.
Attorney Tom Merriman says no one should be against the elimination of unneeded tests. But you as a patient should examine who is behind those recommendations. Are insurance components involved?
If the doctors are saying that's an unnecessary test, I'm all in, okay? Let's just make sure that the people who are making these decisions are not people who are making it based upon their own bottom line.
Consumer Reports says these are 3 tests you or your loved ones should get: cervical cancer, colon cancer, and breast cancer. After being prescribed all of her medications and having surgery, Christine's mom is doing fine. And they say the main thing they've learned is to have an educated conversation with your doctor, and don't be afraid of asking questions.
In order to actively participate in making the best healthcare decisions for them.